Welcome to the Provincial Preschool Autism Service Autism Education Series on the topic of understanding autism. My name is Katie Carroll, and I am an autism educator with the Provincial Preschool Autism Service. I am pleased to share this information about autism with you. I would like to respectfully begin our video with a land acknowledgement. IWK Health is located in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people for over 13,000 years. The Provincial Preschool Autism Service is committed to working together with Indigenous communities and leaders to co-create a path forward focused on reflection, understanding, awareness, reconciliation, and action that honors the knowledge, wisdom, and strengths of Indigenous peoples and recognizes the historic and present-day harms and traumas experienced by Indigenous peoples. It is a privilege to be able to work together to impart these values in supporting autistic people. A little note about language before we get started. The Canadian Autism Spectrum Disorder Alliance, CASDA, is striving to create a public platform that feels welcoming and safe for the autistic community. To support this work, with the help of autistic Canadians, they have created a guide on preferred language to members of the autism community, including policymakers, researchers, healthcare workers, and caregivers. For your information, the link to this guide is shared on the last slide of this video. Canadians on the autism spectrum have diverse opinions on language and how they wish to be referenced. Many prefer identity-first language, autistic, while others would rather use person first, person with autism. In consultation across the country by CASDA, it was clear that the use of language in the autistic community continues to be an ongoing discussion. As our understanding and acceptance of autism advances, so does the use and understanding of phrases to describe or reference the condition. We want to be respectful of everyone's unique preferences, which is why we chose to use references to autism interchangeably in our documents, with the hope everyone can see themselves reflected in this resource. Processing an autism diagnosis. It is normal to feel any number of emotions as a parent or caregiver of a newly diagnosed autistic child. You may feel overwhelmed with the journey ahead, you may feel sadness or fear, or you may feel relief for the explanation of the signs you have been observing. The PPAS, so the Provincial Preschool Autism Service, provides effective services and education for autistic children and families to help improve outcomes and quality of life. If you are experiencing concerns with your mental health, please consult your healthcare team and visit www.mha.nshealth.ca for local mental health support and resources. There is also video in this series about taking care of yourself. Let's talk about the features of autism. Autism is generally recognized in the first 3 years of life. Autism may be diagnosed later in some individuals. Parents usually are the first to suspect that something is different with their child. As early as possible, parents should ask their family doctor or another healthcare professional for an opinion. A diagnosis of autism consists of a comprehensive assessment. Concerns in social development may include less awareness of other people and their feelings, different use of eye contact. These children may appear to have a preference for doing things alone, difficulty playing or working in groups, and difficulty making friends. When we think of communication concerns, we may see delay or differences in the use of speech and gesture, poor understanding of language, including gesture and facial expressions, differences in how speech sounds, repetitive speech, so this could include echoing what other people say, and difficulty with taking turns in conversation. Here are some things you might observe regarding your child's behavior. You may see patterns of behavior that are restrictive or repetitive. So, for example, motor stereotypies, such as flapping and waving of the arms. There may be repetitive speech, so this could include echoing what other people say. There may be a focus on routines, wanting things to be the same. So, for example, the same food. There may be very focused on specific interests. So, for example, a strong attachment to a specific object. In terms of sensory concerns, autistic people may be overwhelmed by sensations such as a loud noise, bright lights, but they may also really like other sensations. Sensory preferences are individualized to the person. In terms of sensory concerns, autistic people may be overwhelmed by sensations such as a loud noise. Here are some general facts about autism. Autism is a lifelong neurodevelopmental condition. It is described as neurodevelopmental because it is a difference that people are born with, and it involves the brain and nervous system. Autism is not something that can be cured, but features of autism can be supported and skills can be developed and improved as appropriate for the needs and goals of the individual and family. According to the Public Health Agency of Canada, estimates show that about 1 in 50 children and youth in Canada, ages 1 to 17, have been diagnosed with autism. This is 2% of Canadian children and youth. In Nova Scotia, 1 in 31 preschoolers are diagnosed with autism. While these numbers can be alarming, it's helpful to know one parent stated, "It is helpful and hopeful to know that I'm not alone." Some facts about autism. Autism is much more commonly diagnosed in boys than girls, 3 times more often. We also know the diagnosis is commonly missed in girls. The causes of autism are not fully understood, although genetic and environmental factors are important in understanding the likelihood of a diagnosis of autism. There is diversity in how autism presents and evolves over time. Autism is understood to be a spectrum of experiences. Using the term spectrum emphasizes how unique each autistic person is. No 2 autistic people experience the world in the same way. Autism is complex and multidimensional. It is not linear. Early intervention can make a big difference in the lives of individuals with autism. Let's talk a little bit more about early intervention services. Nova Scotia Early Childhood Development Intervention Services support families in enhancing their child's development through a variety of services. Child development support includes support for screening, monitoring, and the development of individualized programming and strategies. Programming takes place in families' homes and in early learning and childcare settings. Family support and capacity building. This includes providing opportunities that strengthen parenting knowledge and skills, which promotes a positive sense of parenting competence and confidence. Case coordination and partnerships. In partnership with families, supports are provided for service coordination and navigation, ensuring families are connected to the supports and services they need, and facilitating communication and teamwork across service providers. Transition planning. Assistance in the transition process through systematic planning and the preparation of the child, the family, and the receiving setting. So, for example, childcare, pre-primary, and primary. If you have any more questions or would like more information, please visit the Nova Scotia Early Childhood Development Services website at www.nsecdis.ca. Another example of early intervention services includes speech and language intervention. Individualized speech and language therapy programs can improve speaking and non-speaking communication skills. For example, asking for help, requesting a favorite item, using a speech output device, asking and answering questions, reading books and telling stories, play skills, and the development of speech sounds, to list a few. Occupational therapy helps teach or improve everyday skills, such as getting dressed, body awareness, eating independently, balance and coordination, navigating common or new situations, fine motor skills like using a zipper or cutting with scissors, gross motor skills like walking, throwing a ball, or riding a bike. Behavioral intervention helps to build skills and reduce harmful or dangerous behavior of concern. This work is done by building communication skills, learning flexibility and cooperation skills, developing social skills, learning health and safety skills, recognizing and responding to emotions, and increasing independence in daily routines, such as eating, using the bathroom, and sleeping. Autism through the lifespan. The degree and types of support an autistic person might need varies greatly. This depends on the person, their experiences, and their environment, and it can change throughout a person's lifetime. Autism acceptance. The goal of autism acceptance is to embrace autism in a neuro-affirming way. Autism acceptance involves developing an understanding of autistic people's ways of being, thinking, and doing, and recognizing those ways as valid. This also includes accepting and embracing autistic people's differences in all aspects of society. Autism acceptance works to change public attitudes and behaviors towards autistic people. Autism services. Our services align with Public Health Canada that states that programs and supports for people on the autism spectrum should build upon individual strengths and abilities, be available in different settings like home, school, community, bring together different supports that promote independence, skill development, community involvement, and most importantly, involve family and caregivers when appropriate. In closing, I would like to state our commitment. The IWK and our community system partners, including Hearing and Speech Nova Scotia, Autism Nova Scotia, and Nova Scotia Health Authority, are committed to improving the health and well-being of autistic Nova Scotians and to supporting families and caregivers to receive the best possible service. Thank you so much for watching this video to gain more understanding about autism. In the Autism Learning Hub section of our website, you will find links to additional helpful resources, including links to our community partners. On this slide, you can see links to the resources that were mentioned in this video. Thank you.